All right. Ladies and gentlemen, please direct your attention to the stage as we welcome a true force of inspiration and empowerment. Coming to the stage is none other than Tamika Felder, a beacon of hope and resilience. Tamika has dedicated her life to driving change and empowering others. As a 21-year cervical cancer survivor, she founded Cervivor Inc. to empower those impacted by cervical cancer worldwide. With her captivating speeches, award-winning productions, and insightful writings, Tamika ignites a spark of resilience in all who hear her story. Let's give a warm welcome to Tamika Felder.
Hello, everyone. Thank you for joining us here in person. I also want to thank our virtual audience, our virtual attendees. Hello to everyone, wherever you are, especially our viewers in Kenya and other parts of Africa, and also our Caribbean survivor sisters. You are indeed a special part of this community, and we are happy to have you here. This summit is packed with a lot of information, a lot of sessions. There aren't many breaks, but if you look at the housekeeping, definitely take time for self-care. If you need to stretch your legs, get up. If you need to take a minute because some of the sessions may be a little overwhelming, take that time for yourself. We hear things and we never know how they are going to impact us because of what we went through. And if you need a hug, if you're okay with hugging, let the person next to you know. If you need someone to hold your hand, if you need to cry, don't worry about crying. In this room, we cry a lot. I almost cried this morning walking in here. It's been a journey getting to this summit and a lot of work put behind it. Things are never going to be perfect. So if you give us a little grace where we're lacking, we assure you that we'll show up in other ways that are just fabulous. I am extremely proud to introduce our morning keynote speaker. How many of you watched the White House Forum yesterday? It's a lot of hands. Thank you, thank you, thank you. I was honored to be there, and while you saw my face, you heard my voice, know that I carried each and every single one of you with me. So if you see me there, you were there too. And it is not the end of our journey with the White House. It's up to us to make sure that we share the stories, we make the data come alive, and we want to be allies in a nonpartisan way to making sure that we are a part of the road to eliminate cervical cancer. We know because we've been impacted directly. So with that being said, it is my true honor to welcome Dr. Catharine Young, who is just a vital part of the Biden Cancer Moonshot, but also a vital part of knowing our stories, knowing cervical cancer, and knowing what it takes to keep the momentum going to end cervical cancer. So thank you and welcome, Dr. Young.
Well, good morning, everyone. And thank you, Tamika, for this really incredible opportunity to provide a few remarks here. I'm really honored and I'm humbled to be sharing this time with all of you this morning. Time. It is undoubtedly our most precious resource. And over the course of my career, I have had the privilege of spending time with so many incredible cancer advocates, many in this room, and patients and survivors and caretakers. People who have fundamentally altered my outlook on life and the value I place on time. And through this community, I've also felt incredible loss when time is suddenly taken away, when you can no longer get it back or replace it. I know that throughout these remarks that I give today, the words I offer you cannot physically ease the hardships that you have faced or you continue to face every day. But I can tell you that with this White House and this president, we are working as hard as we can to end the devastating impact of cervical cancer. As Tamika mentioned, my name is Catharine Young, and I serve as one of the assistant directors for the Cancer Moonshot. an initiative that began back in 2016 by then Vice President Biden and was reignited by now President Biden and the First Lady almost 2 years ago. And for those of you who may not be too familiar with the Cancer Moonshot, it is an initiative that seeks to decrease the cancer death rate here in the United States by 50% over the next 25 years. That translates into saving about 4 million lives within that time period. And although speaking as a scientist myself, and I know there are probably many in this room who love numbers and stats just as much as I do, it is essential to remember that this goal is so much more than numbers. These numbers represent real people. In the case of cervical cancer, the most precious people in our lives, our moms, our grandmothers, our sisters, our daughters, our loved ones, all looking for more time together. And that is why there is a second goal to the Cancer Moonshot, and that is to improve the experience of those living with and surviving cancer. In simpler terms, the Cancer Moonshot wants to build a world where the word cancer loses all of its power, where a diagnosis isn't a death sentence, where we prevent cancers like cervical cancer before they even start, or where we catch cancer early enough so people can live the long and healthy and fulfilling lives that they were meant to do. The Cancer Moonshot team sits at the White House Office of Science and Technology Policy, and it is our job to ensure that the president's audacious goals become a reality. And no, if you're wondering, it is not an easy task, but it is not called a moonshot for nothing. But what you may not know is that we are not the first moonshot initiative. 60 years ago, President John F. Kennedy delivered his moonshot speech at Rice University, committing to putting a man on the moon and bringing him back again. President Biden's vision is for another American moonshot, ending cancer as we know it. It is a vision that will change people's lives, improve their health, and decrease the burden of this disease in this country. It was also on the 60th anniversary of John F. Kennedy's moonshot speech when President Biden clearly stated that the Cancer Moonshot was one of the reasons why he ran for president. And he has since made it clear that this is a fight he is unwilling to postpone. The same words President Kennedy used when he spoke about choosing to go to the moon. And when President Kennedy set that goal, he established a national purpose that could rally the American people behind a common cause. And he succeeded. And now it is our time. President Biden has made it clear that the moonshot is a priority and included it on the unity agenda when he previously spoke in his State of Union address to rally the American people behind this mission. Because if there's one thing that we do know, it is that cancer, it doesn't discriminate. It doesn't care who you are. It doesn't care if you vote blue or red. But beating it is something we can do together. Because when it comes to solving really large, complex problems like cervical cancer, you realize very quickly that you cannot do it alone. Not only is the disease itself challenging, but the breadth of challenges that are associated with the disease are enormous. For example, and many of you sitting here have probably experienced these very things. We often receive a diagnosis too late. We experience inequities when it comes to access to vaccinations, screening, and optimal cancer care. And we do not know how to optimally treat all patients yet anyway. And these are all the areas that the Cancer Moonshot is focused on seeing real and impactful solutions come to fruition. So I thought what might be helpful today is share with you 4 levers that we use to drive our work forward, especially because you're all advocates sitting here in the room. The first is collaboration. There is not a single person here who doesn't inherently know that just how important collaboration really is. The president knows this very well and has assembled for the first time a cancer cabinet, which brings together over 25 different federal agencies to ensure a whole of government approach to tackling cancer. It includes agencies you wouldn't think would be part of a cancer cabinet, like NASA, Department of Labor, Department of Commerce. And we ask the question, what more could we, and more importantly, should be doing for cancer patients? And the beauty of this collaborative approach is that every agency and department brings with them a completely set of different resources, different perspectives, different tools, different focuses, which means that we are able to offer new solutions for cancer patients across the spectrum of their experience, from prevention, screening, treatment, and survivorship. And because of the president's leadership and other agencies, we have seen over 50 new programs and initiatives that have been sparked by the federal government to help accelerate solutions forward for cancer patients, including for cervical cancer. For example, the Department of Health and Human Services has committed to accelerating efforts to nearly eliminate cervical cancer through screening and HPV vaccination, with a particular focus on reaching people who are most at risk. This includes the Centers for Disease Control and Prevention, or the CDC, that has invested over $15 million to prevent and detect HPV-related cancers. The second lever is partnerships. We at the Cancer Moonshot would fail at our job if we believed that the government could solve all the issues for cancer patients. It's just not possible. And where gaps exist, we work to make sure that the private sector, academia, nonprofits are all working alongside us to fill those gaps, particularly around key issues like social determinants of health, tackling questions like how do we get patients to and from their appointments? How do we make it easier for patients to access and participate in clinical trials? How do we ensure patients who live in food deserts have access to the nutritious foods they need during their recovery? Over this past year, in response to the president's call to action, we have announced over 100 commitments from non-federal partners, all contributing to the mission of the Cancer Moonshot and working to improve the lives of cancer patients. And it's with these types of partnerships, bringing people together that wouldn't ordinarily be at the table, where we can start to build the infrastructure needed to accelerate progress. One where we create a system that fosters innovation and creativity, that rewards risk-taking, and that gives patients what they deserve. A system that puts saving lives above everything else. We are so appreciative of everyone who has stepped up in response to the president's call to action to come together to see change happen. And it is that in that spirit that I'm also delighted to announce, although it seems like everybody is aware, that yesterday the White House hosted the inaugural Cervical Cancer Forum that convened patients, caregivers, oncologists, researchers, and federal partners who are well positioned to move the field forward so that we can together make change happen. And I do believe, following yesterday, that that will happen. The third, and this may be arguably the most important for our work, is engaging completely with the community we serve, like you. The Cancer Moonshot, together with the Cancer Cabinet, has hosted over 50 listening events with patients around the country. We also provide a direct line of connection with us for anyone affected by cancer, where you can submit your stories, your ideas, and your actions that you think are worth taking action. In fact, if you have any ideas and would like to share them with us, or you would like to share your cervical cancer story, we would love to hear them. And you can submit them on the Cancer Moonshot website found on the White House website. The fourth is you, and understanding the power that you have to make a difference. In this case, being a cervical cancer advocate, ensuring the voices of those affected and those that are no longer with us are heard and remembered, ensuring that the cancer system is reimagined so that it serves everyone equally. A chorus of voices is so much more powerful than a singular voice, and is undoubtedly one of the most powerful tools that we have in our change-making arsenal. And it is because of advocates like you who fought and won for the creation of a new federal agency called ARPA-H, the Advanced Research Projects Agency for Health, created by the president to help develop and accelerate new treatments and drive innovation, that has already committed over $240 million to cancer-specific projects. You have traveled all around the country, I'm sure, to be here today. Some of you probably great distances. And so I want to take this opportunity to thank you for using your voice, your stories, and your precious time to advocate for change. Because when we can effectively communicate the importance of why change must happen, when we can come together, which is the ultimate way we will achieve the president's audacious Cancer Moonshot goals. And when we come together as a nation around ideas that unite us, like fighting cancer, we can show the world that anything is possible. If we can put a man on the moon, we can eliminate cervical cancer. The president has long believed that America can be defined by one word: possibilities. And the American people demonstrate every day what is possible, which gives us the hope that we will reach the president's goals and place time back in your hands. Thank you for your commitment to this fight. It truly makes a difference. Your voice, your input, your work are critical for us to continue making progress towards ending cervical cancer as we know it. Thank you so much. And now I'd love to actually open up the floor for a conversation in the remaining time that we have. Tamika, I'm not sure how much time that would be. We have some time. So happy to take any questions. If you would like to share with us in the audience some of the greatest challenges that you would like us as the White House Cancer Moonshot to know about, if you have ideas of what you think is important for us to start considering and taking back, would love to use this little bit of time to chat about that, if you would be willing. So please, yes, just raise your hand and I will call on you and have you speak. So go ahead.
Hi, I'm Lori Wallace. I am a cervical cancer survivor and I'm from Metro Detroit. I think that one of the most important things with regard to cervical cancer is stigma. So what prevents people from going to the doctor, from going back to the doctor after those irregular cells are identified, by following up, by talking about it, asking for support, is the fact that people used to be made to feel that it was, you did something.
Right.
Maybe you smoked, maybe you had more than one part. And that was all the information that you could get before the internet, when it was just medical books, that was it. So people didn't talk and they went through this alone. So if we can normalize the discussion, I think that is a major first step.
100% agree with you. And thank you for that comment. I think, for those of you who were watching the White House Forum yesterday, live streamed, Tamika, I believe it was you right at the end that brought up stigma and said this is something that we have to tackle as a community, as a medical community, as a research community. And so, yes, I do believe this was very much a topic that was spoken about yesterday. So for everyone's awareness, besides the live stream part yesterday of the Cervical Cancer Forum, which is available online if you would like to watch it, because we have an incredible star that was in it. we had 4 breakout sessions as well, where we brought the people in attendance to talk and really discuss and surface solutions for pressing issues around cervical cancer. 2 of the working groups were for local domestic challenges and solutions for vaccinations and screening and care. The other 2 were global. So what are our big global challenges we're facing with cervical cancer? And I believe that in one of the working groups, stigma was indeed addressed on that. But you're absolutely right. It is something as a community, I think we can work very hard to address as well. Tamika. Working group C. There it was. Thank you, Tamika, for pushing that forward. Yes, absolutely. Yes.
Hi, my
Hi.
name is Belinda Hayes, and I'm from Alabama. And my
Yes.
job is like for an outreach coordinator. What is you all trying to do to help these rural areas? Because when I go to these rural areas,
Yeah.
they're not educated,
Mhm.
and they don't have the resources to be educated. And we're trying to push the HPV vaccination, but if they don't know, they don't know, or they don't know the importance of getting screened. And
Yeah.
the comments that I get, one lady told me, "Well, I'm living now, so I'm okay."
Mhm.
So what is you all trying to do to get more facilities in these rural areas so
Yeah.
these people can get the screening
Yeah.
and have access to it, and also being able to educate them
Mhm.
on this serious condition, because a lot just don't know, so they don't take it serious and don't know the importance of the screening and for the follow-up. So is there
Absolutely.
any type of plan or
Yes.
something you all trying to do to help those areas?
Yeah, thank you so much for that question. The inequities that we face here in the country are great and very stark when you think about rural based on urban and even different communities within them. So the Cancer Moonshot very much is addressing that with the federal government's power. So, for example, we are connecting through the Health and Human Services, um, uh, NCI, Centers of Cancer Excellence Centers, with federally qualified health centers that are in the rural communities. We are connecting those together so that those community centers who see patients from rural communities have a very strong pipeline for those patients that may get screened and diagnosed to treatment and care. I think that is an important part to remember, because even if we are able to reach patients in the rural communities and they get screened, one of the biggest challenges that we have is that follow through. So making sure that they actually get the diagnosis that they need, then they get the treatment, and then they get the aftercare as well. And so we are building, there are millions of dollars being put into that to build that pipeline to ensure that those patients have the best care available to them as well. The other thing I'll just really mention really quickly is I mentioned a new agency called ARPA-H that was just created. They are creating also with millions of dollars a hub and spoke model for clinical trials. And the reason for that is because we know that patients especially in rural areas don't have the opportunity to participate in clinical trials. And so ARPA-H is looking at the country as a whole, saying, where are the biggest gaps that we can fill in to start getting patients interested and start getting them into and enrolled into clinical trials as well. And I think we're going to see a big difference with that as well. So thank you very much for your question on that. Nancy, I have one right back then, if I can come to you, if that's okay. Thank you.
My name is Larissa Sellers. I'm from Oklahoma City. And I guess I had a question about the timeline as far as getting your pap smears and your gynecological tests. For me, I went from 1 year having nothing abnormal to 2 years later having a full-blown stage 3C cervical cancer. And I see now that it's recommended that you only see your gynecologist every, I think it's 2 or 3 years to get these tests done. And for me, that's incredibly concerning because I went from 0 to 100 within that time.
Right.
And I know it's it can be difficult because insurances won't cover it. If it's, not recommended by your doctor and things like that. And I just find it so frustrating because so many women can get very ill in that time period. And so I was just wondering what your thoughts are on that. And if you think it's,
it's a complex question, and it's something we think a lot about across the range of cancers, because the most important thing is that we catch cancer early. We know that health outcomes are the best when we're able to do that. The complexity comes in is that we have a body that makes those recommendations on when screenings should occur based on the evidence and the science that they have at hand. And then insurance companies will then base their kind of reimbursement based on those recommendations. So to your point, if your cancer starts to spread in between that timeline, then you're not going to catch that early enough. There are many kind of components that the federal agency and the government thinks about, including the resources that are required in order to get people screened within a short period of time, but then also the additional kind of mental strain that puts on patients as well to have to get to those appointments, and then what happens when you get a diagnosis, and so the governing body that makes those decisions, they take all of those things into consideration, but they do change their recommendations as evidence and data and research comes into it that may suggest it needs to change. I'll just bring in colon cancer, for example. We are seeing a major shift in the age of individuals being diagnosed with colon cancer. And so I would imagine that we would start to see those recommendations actually start changing once we get the data in to really kind of, solidify those changes are real. So thank you for your question. Nancy.
Hi, thank you so much, Tamika, for inviting me to this great meeting. I really appreciate it. Catherine, just wish you a lot of good luck in this role. And I think it's important for all of us to give a shout out to the Bidens for doing this, because it is so important to have real leadership on the part of presidents and first ladies. And Dr. Biden came and saw our Promise Fund model very early on. And it made such an impact. And I want to make sure that all of you get a chance to thank them. I mean, it is so admirable when a president and first lady does this sort of thing. They've got a few other things they have to do. And so thank you. And I just wanted to say I'm representing the Promise Fund of Florida, which is trying to deal with we are dealing with it. And I just have a couple of suggestions.
Please.
Because we are partnered with the Federally Qualified Healthcare Center. And so it's a private-public partnership. We're scratching and raising money, and also people. And the comment before about the rural thing is really sad. We have 90 to 100,000 women in Palm Beach County, if you can imagine, who have no primary care. And my first goal was to see if I could move away, because it's hard to watch that or even hear about it in this day and age. Second thing is, I long for the day when we get Medicaid back. Whatever governor voted it down, they need to really think about this, because it's an important system in our country. And then the other comment that was made about getting people to care at the lowest cost but the best quality, and then navigating people. We have 19 navigators in our system now, and it's unbelievable the difference it makes.
Absolutely.
And so I just wanted to give you all a shout out, Catherine, and you and everybody here. The work is so appreciated. I can't tell you, and I'm excited to see people take up the sword against cervical cancer. I mean, it's so long overdue to create this movement. And Tamika here, and her group, and the rest of you. And later on, when I talk, I'll tell you how we created the Promise Fund. Okay, thank you. Wait.
Oh, so Nancy, first of all, thank you for all the work that you're doing. I know that the First Lady is very supportive of your work, and we thank you, because it really, a big part of the Cancer Moonshot is not just about mobilizing federal government resources. It is about making those connections with organizations like yours, and those public-private partnerships are incredibly important. On your point on patient navigation, I do want to just share with everyone that recently, under the First Lady's leadership, we now have the ability for patient navigators to be reimbursed through CMS. This is a major step forward for supporting cancer patients from the time of their diagnosis through their entire journey. The idea that you can have a cancer patient navigator guide you through that process, answer the questions, provide guidance in terms of clinical trial enrollment, treatment options. I mean, this is really, I believe, going to be transformational for our patient and for patient care itself. So I did want to make sure that everyone was also aware that that has just happened as well.
Hello, everyone. Thank you so much for this opportunity. My name is Travis Michelle, and I'm from NYC. So welcome everyone to my beautiful city. My question is, I'm a registered nurse. So going from RN to patient and always advocating, but seeing how difficult it is for insurances to approve our treatments. So I'm so in support of everything we're doing, but do you have a specialized committee that is working with the insurance companies? Because some of us have to wait weeks and fight in order to have a CAT scan done when really we need to have an MRI done. So are you working closely with the insurance company to change that? Because everything starts really with them.
Absolutely. And thank you for raising that point as well. And of course, I think anybody in this room would agree that insurance is, the bane of our existence in many cases. And absolutely, we are working closely both with CMS, which is the federal agency kind of regulating federal insurance, but also on the private insurance side as well. We work very, very closely with them. What tends to happen is when CMS makes a decision about something, private insurers typically tend to follow that. They can be a little bit behind sometimes, but that is typically the trend that happens. And so our goal is really to influence on the federal side as best as we can, knowing that the private insurance will start to feel that pressure to really fall in line once those changes are made as well. So we are working with them. We have conversations all the time, not just with them, but with stakeholders who are affected and have had really difficult, challenging situations with them, just to make sure that we are continually grounded in those stories and pushing forward what actually matters for the patients when it comes to insurance as well. But yes, short answer is yes, we are having those conversations.
Good morning.
Oh,
Good morning.
okay.
Dr. Young, thank you so much for your presentation. Wonderful information, and I'm so proud to hear about the Biden Moonshot. I did not know about that, so every day we learn. My name is Dr. Julie Bassan. I'm from Laredo, Texas, South Texas. And, getting to network with these wonderful women is really, really something very important to me. Somebody asked me, are you a survivor or are you a caregiver? And I had to pause. I'm neither one, but then I thought I'm an advocate. I am the chair for the Texas HPV Coalition, and talking about advocating, educating, we do the best with what we have. I thank you for sharing with us that there's been an additional initiative formed to help maybe link or bring resources to the community so that we together can advocate and hopefully decrease the number of cancer. How can we do that? I know I heard a lot of wonderful comments and ideas. One of the things, coming from a rural area where we are located right at the border of Mexico and Texas, 150 miles away from the nearest metropolitan city, and with 35% underinsured, we do the best we can with educating, advocating, but then many of the people say, well, why find out if I have cancer? There's nothing that I can do to treat it or take care of it. And so I want to present to you a question. How can we, as communities, wherever we might be located in rural areas, draw down those resources or make aware the people that are at the healthcare industry, health services, aware of there's this initiative, apply for this funding so that our community can get those services. I lead a nonprofit and I've been the director for the last 25 years. How can we help you get the message to these communities so that those service providers can have access and we can serve our communities?
Well, thank you for that. And yes, I think you raise a very, very important point is getting the message out there to all Americans, especially Americans who really need it the most. And that is an incredibly challenging thing to do. I mean, you just said you hadn't heard of the Cancer Moonshot before, which means that we're not doing a great job of getting our messages out there, which is it's a challenge. We are working with the federal agencies who are driving those specific programs to ensure that they are making every effort that they can to connect with the communities and make sure that those members in the community are aware of those services. But it is also important and on us as a Cancer Moonshot to engage with community leaders like we are doing today, to hear these things and to be able to take that back to our teams and our work to really funnel these ideas and other comments so that helps us drive our work and we know where to focus. So thank you for raising that. It is a very important issue. And like I said, we have an open channel to the Cancer Moonshot. We listen, we connect, we talk. Anytime any of you would like to talk to us, you are absolutely welcome to as well.
And I just want them to know that I always email either you or someone else on the staff with ideas and suggestions.
Yes. And we listen, I mean, we get ideas and suggestions all the time and we value them. We are really driving what progress should look like based on what patients and caretakers and those that are really affected by this disease, what they are telling us. So please, like I said in my remarks, your voice is the most powerful thing that you have in your change-making toolbox. Please use it. Let us know if you have any thoughts or ideas. We want to hear them. A lot of time people think, oh, you're over there in DC, you're busy, you're not going to want to talk. That is not how we operate at the Cancer Moonshot. We want to hear from you. It is vitally important that we do so.
So we're going to take 2 more questions.
Quick questions.
Hi, I'm Dr. Jennifer Young Pierce. I'm a GYN oncologist at the University of South Alabama in Mobile, Alabama. And I also serve on our Society of GYN Oncology Cervical Cancer Task Force. So I'm excited to represent those voices today. And a comment and then a question. One comment about connecting federally qualified health centers to NCI designated cancer centers. Just a reminder that the NCI designated cancer centers are only 4% of the cancer centers in this country and only serve 20% of cancer patients. Our patients who are seen in a federally qualified health center in Mobile are 4.5 hours from the nearest NCI designated cancer center. And unfortunately, the federal government does not provide funding for transportation. So reminding folks that there are academic medical centers in their communities. And what we really want to stress, especially for cervical cancer patients, is that they see a gynecologic oncologist. And those gynecologic oncologists are at centers of excellence in cervical cancer care, but that is not always an NCI designated cancer center. And I worry that if we push specifically for NCI designated cancer centers, we are still leaving our rural patients behind.
Yeah, absolutely. And thank you for that. The very important points. I don't think we're just trying to push for that. I think that is a starting point for us. I think it is one way that we as the federal government can really push progress forward. It does not mean it is comprehensive, and it does not mean it is the only way that we're going to tackle these issues, especially for patients in rural areas, but it is the start. And so your points are very valid and well taken, but to know that this is what we're hoping is that this Cancer Moonshot continues for many, many years, and that we continually every year are bringing new solutions for cancer patients. Sometimes it can take some time, but we are actively working and thinking through a lot of these issues, but very much appreciate your comments as well. Thank you.
Last question. My name's Danielle Merzada, and I just think it's unacceptable that the recommendation continues to be 5 years for pap smears. That's it.
Thank you. Appreciate that very much. All right, so Tamika, where are we?
Thank you so much, Dr.
Thank
Young, for
you.
sharing your knowledge and perspective with us.
Thank you very much. Appreciate it. Thank you.